I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video edition on stress, styes and Chalazia. So a lot of patients come in and see me with lumps and oil gland lumps, and they may be referred in, they look like cancers, people worried they're cancers, or people come in with recurrent disease that causes all sorts of problems such as droopy eye, and they ask why. Well, it's like acne, there is not one cause. But the most common factors that affect this are inflammation. So if you've got inflammation around the eye, you're predisposed to oil gland disease, which manifests as styes and Chalazia. Hormones, so around puberty and other forms of hormone dysfunction, you can get oil gland disease. The microbiome, which is the bugs around your eyes, because the bugs have an interaction, and when you alter them by putting antibiotic drops in just because you feel you might need them, don't do it. You can precipitate oil gland disease, and that happens after people have surgery. They use too many drops. And the final thing is dietary fats. So what you eat will get secreted and cause inflammatory disease. So this one is about hormones, stress. And stress is really important. Patients will come in and I'll ask them, are you feeling stressed? They go, every time I get stressed, I get these lumps. And it is true. When you are stressed, there's a huge drive from through your autonomic nervous system, your neocortex, your frontal cortex, plugs into it, goes through into your hypothalamus, out goes all the hormones, through to your adrenal glands, etc., and it will drive hormone-sensitive tissues, and oil glands are one of them. So we live in a society, a stressful society, I call it anxiety society, and people seem to be getting more and more, and I saw this during COVID, it went through the roof. There's other reasons why during COVID, including the terrible diet that everyone followed, oil gland disease went through the roof. And the reason it's important is if you can learn to manage some of these factors, you can reduce the incidence of recurrence, you can reduce the incidence of the onset of these problems, and you can hopefully speed up their resolution by doing very little other than managing stress, which has huge other benefits to you. So I think it's important because we don't talk about stress, styes and Chalazia, but it's important that you recognize the relationship. That doesn't mean go and medicate it with benzodiazepines. It means identify the precipitating factors, work, lighting, family members that drive you mad. Identify them, and then you can control them. So I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.